we'll just start at the top. My name is Peter Clark. I'm with Senator Shaheen's office. And then I think I have James next. James, do you want to introduce yourself?
Sure. Nice to see everyone this morning. I'm James Patry. I'm the System Director of Marketing for North Country Healthcare, and I'm the Director of Patient Experience and Marketing for Androscoggin Valley Hospital.
You have a much nicer view out your window than I do.
It's a beautiful day here today.
Yeah, it looks gorgeous.
Thanks, James. Next I have Mike on my screen.
Hi, Mike.
Good morning, Senator Mike Peterson. I am the President and CEO of Androscoggin Valley Hospital.
Nice to see you.
You as well.
Thanks, Mike. And now I have Brian.
Hi, Senator, and good morning,
Brian.
everybody. And I so wish that we were all together. I mean, I'm a little old school in that regard, but
Me too.
We're acclimating to Zoom, so we miss you. It would be lovely if you were here.
Yes.
So I'm Brian O'Hearn, and I'm the Chief Nursing Officer. I've been with ABH going on 6 years now, and again, Vice President for Patient Care as well. So again, welcome. Glad that we're talking today.
Thank you.
Thanks, Brian. I have Sam next on my screen.
So I believe.
Hi, I'm Sam Kilbride. I am acting today as the executive assistant to Brian O'Hearn, just recording the meeting for you guys. So ignore me.
Good. We like your image on the screen.
Thank you. Underdog is life.
Yes.
Chuck, you're next.
I'm Chuck Henderson. I work for the Senator in the North Country and have the pleasure of being on a call with Michael and Brian every other week for the CCFHS COVID call, which is very informative. Thank you, guys.
And I can assure you that Chuck keeps me very well informed about what's going on. His write-ups are always fun to read because he has very good local anecdotes that are very informative.
Thank you.
Thanks, Chuck. And then I know from the press today, we have Barb Tetrault from the Berlin Daily Sun, and we have Keith Baldy from WMUR, and then we have Alan from our communications team here as well.
So good morning, Keith and Barbara.
Morning, Senator.
So I really appreciate, as I said, everyone's taking time this morning. I had hoped to be in Berlin, but this is an opportunity for me to hear what's happening with the hospital. I know there have been some cases at the prison that have been identified of COVID. I know there are financial issues with hospitals across New Hampshire. I'm not sure what's happening with Androscoggin, but as we look at how we hopefully can get another package of assistance for people in this pandemic, I know that hospitals need to be a piece of that. We worked really hard to try and address the Medicare Advanced Payments Program to try and get the interest rate down to a reasonable amount, to try and get CMS to be more reasonable about how they were asking hospitals to reimburse those loans. And we made progress. We didn't get everything we wanted, but I think that was good news to get some of those changes on the continuing resolution that passed. And we'll have another shot when that continuing resolution expires in December to see how things are going and to try and make the case again that we need to take a look at the way the program was set up. And again, I know there are financial challenges because all of you who are managing hospitals in the state made real sacrifices to shut down voluntary procedures when the outbreak of COVID began, and that's had an impact, not just during this period, but as I've talked to several other hospitals in the state, people have been reluctant to come in for procedures that they would normally be doing because they're concerned about the virus. So I'm really anxious to hear what you all have to say and to see what more we can do to try and be helpful in DC. So thanks very much. And I don't know, Peter, who we want to turn it over to at this point? Michael,
I think
maybe?
We'll turn it over to Mike. Yes.
Well, thank you again, Senator, and I appreciate all the support throughout this pandemic. Our delegation has been fantastic in keeping in mind all the help we need up here in the North Country, and we sincerely appreciate it. The advancements, as you mentioned, with the accelerated payments was a welcome received advancement. We hope that the next round potentially could go further in terms of any portion of those accelerated payments being converted to grants would be very helpful. However, we are basically anticipating that it will all be paid back. The additional time that we have and then the lower interest rate, actually for ABH anyway, the interest rate is almost irrelevant. We plan to pay it all back before interest starts,
Great.
clocking in. So we're grateful for that. The rest of the finances, I think I shared in an email to Peter yesterday, kind of outline the amount of funds and the source of funds that have been received, and all of that's very welcome. It allowed us to stay solvent and liquid enough so that we did not have to lay anybody off throughout the duration of the pandemic so far. We were proud to say that. We're proud to say we're committed to keeping that regardless of what happens going forward. And that liquidity that's been provided with these funds is the mechanism to do that. However, as you noted, we're on the upward trend again, and it's still the uncertainty is the reality we face. So we're grateful to have that. However, we've booked zero funds so far because things that were applied for as grants are still loans. We're just filing our reapplication for the state that was been denied once already because they said we couldn't prove lost revenue, which baffles my mind because we just turned in a financial fiscal year that had us $12 million below our target for gross revenue anyway. It's pretty easy to point out. I mean, we basically took 3 months and shut off our elective procedures, and that's critical to us. ABH does tend to be specialist heavy, and a lot of our specialties did not come through the door, and for the right reasons, public health interest. The reality is some of those did not, it took a long time to come back. As you mentioned, there was some apprehension and reticence to return. We took an active role in a statewide campaign about Mask Up New Hampshire and about returning to safe environments. The good news is we're a healthcare organization. We know how to do infection prevention, but this is about trust. And frankly, the folks who did return to the hospital and expressed their sentiment, yes, we feel safe. We are complying with the CDC guidelines consistently. That word started getting out in July. When we really started to see a turn of a shift and volume starting to come back. It took a while, but August and September, we actually did have reasonable months because that's a pent-up demand. So we realistically turned the corner towards late summer and started to see a more normal set of volumes. That said, we are still struggling with the availability of the turnaround testing for preoperative testing. We've been lucky compared to others in other parts of the country in terms of turnaround. We've got a great relationship with Dartmouth, and we've leveraged that considerably. They've been fantastic in terms of supporting us with our needs here, and that's helped to keep the pipeline flowing, if you will. We do have some things that we still are struggling with right now, but would also would love to talk to you about some of the future things that we're going to have to struggle with. For example, the good news is now, Senator, we're in a much better place than we were in March in terms of PPE and supplies.
That's great.
We still do understand there's some hiccups in the distribution channels now that the whole nation is struggling with a wave. I hope that doesn't lead to shortages of supply again, like we saw this spring. So we're in a better place now than we were, thanks to the experience. The next round, I hope that doesn't repeat itself with different stuff, is just the distribution logistics around this vaccine. My understanding is the two that are most likely to come out first with the Moderna and the Pfizer studies, both require ultra cold storage. Those freezers are going to be a hot commodity, and just the distribution mechanisms are going to be a challenge for all of us. And recognizing that, I hope we've been talking about that for a while. We don't want to be in the same boat when the vaccine is out, we can't get it out and we can't store it effectively. in the future. That's I anticipate a lot of people are talking about it, but the whole country is going to be talking about it at the same time.
So Mike, can I just interrupt for a minute?
Please.
Do you have any capacity now to store a vaccine that would need very cold temperatures?
I'd leave that to Brian. I don't believe so, but Brian, correct me if I'm wrong. 70 degrees Celsius below.
Yeah, it would probably be equipment we would need to obtain, but I'm certain that if it was available, we would find a way to get that very quickly.
I'm just anticipating that we'll see the same kinds of challenges that we did with PPE in terms of refrigeration.
Exactly.
Whatever is needed to support the vaccine will also be a challenge, as well as the vaccine, I assume. And so that hopefully is going to be factored into the planning. I haven't heard anybody address that piece of it yet. So that's a really good question that we should ask.
Agreed. Exactly. So I am happy to answer any specific questions you might have. We are, grateful that so far in the North Country, we've relatively avoided the clinical crisis. The financial crisis we're clawing our way out of. However, we get hit again with a second wave, and it truly does require us to consider limiting access or limiting elective procedures. We're right back where we were. We will do the right thing for the interest of public health. So what we could also use, now that I have your ear, is continued support in Congress to push on CMS and the administration to revert to the original definition of lost revenue for the provider relief funds. That's the June definition was going to leave us better off than the September definition. And
it's my understanding that they just reversed themselves again.
Is that, Peter, what your email was about? Because you just sent that, and
I sent that last night, so that's what that's about.
Yeah, that's wonderful news because that leaves us in a much better place. 4.2 million of the provider relief funds that I sent, up to 5.6, would be dependent on that definition. So
wow.
Ultimately, yeah, it was a significant amount of money that we potentially would have had to turn around based on the change in definition. So we're grateful for that as well.
That's great. Can I ask you, when you said the state didn't accept your documentation with respect to losses, what were they looking for?
I think that this is a conundrum. They said, yeah, we have revenue gaps that we can prove as lost revenue. However, all these other funding sources are there. And so they denied our application it was a $1.2 million grant that came from the original CARES Act. Well, that's true, but these are all loans at this point. So loans is debt, and we're conservative, fiduciary, responsible organizations. We're going to treat them as debt. So at some point, somebody's going to be first. And we have to convert some of these to grants so that we can use that to offset the losses. We have no problem giving back the money that we don't need to bring us back to at least break even. But quite frankly, we're underwater by 6.2%, and that's an abnormality for us. So unfortunately, if everybody treats it the same way, there's really no benefit.
Yeah. Can I ask, have you gotten any? I know that the guidance has been confusing to date in terms of the PPP program and what counts as a grant and what doesn't. Are you feeling that way, or are you feeling like you're getting the guidance that you need in order to know?
The PPP is actually a little clearer. I mean,
good.
Gratefully, we're feeling very confident we're eligible for that. We just haven't filed the application completed because of the timing. We had to wait for the 26 or 28 weeks or whatever it was. But our application is ready to be filed, and because we can show clearly that with the additional staff that we added as a result of the pandemic and the screeners, I mean, we added FTEs just to do screening at our doors. We're back to better than pre-COVID levels of FTEs. Because we didn't lay anybody off, because everybody came back to work, and because we actually added people. We're very confident in that. We just haven't filed for the application. So that one alone is a pretty sizable support for us.
Good.
Any other specific questions I can?
Well, this question is probably for all of you. And I know, as I said, I know there's been an outbreak at the prison of COVID.
Mm-hmm.
How are are you all working with the medical staff at the prison to help provide treatment? Are they pretty much on their own? Have they reached out to you? I'm just curious about what's happening there and what you all know about the kind of help they might need.
Sure. So I'll kick it off and then hand it over to Brian because he's been integral, and Chuck's been on these calls as well. Ken Gordon, the CEO of Coos County Family Health Services, had an epiphany back in the early days of the pandemic and said, this affects all of us in the community. And so we stood up this COVID-19 community call. It was happening multiple times a week in the peak of the pandemic early. We kind of de-escalated it down to once every other week. It's now back to weekly, just based on what's going on. But it includes the hospital, includes the primary care, both nursing homes, the Chamber of Commerce, both school districts, both prisons, EMS, the city management. So it's basically everybody in the continuum of healthcare is regularly having conversations. We have virtual conversations in between meetings as well. So I'm extremely confident that anybody needs anything, and we have a forum to talk about it. They leaned on us pretty heavily, they being the school boards of the two districts, as they were planning on how they were going to open. So it's really been a give and take from all aspects to make sure everybody had what they need. But more importantly, everyone else was aware of what was going on. So none of this is a surprise. I think it's a testament to how collaborative people in the North Country can be.
Mm-hmm.
And Brian, I'll turn it over to you to add your perspective from a clinical perspective.
Yeah, Mike. Thank you. And I'm so glad that we're discussing this because I think this clearly is a best practice out there. All along, what we tried to do is, without any judgment, without any time spent on how, our goal is to identify very quickly wherever there's any occurrence of COVID, identify it, and then react very quickly to it as a community. And that requires a high level of sharing of not specific patient identifiers or anything like that, but just more so in terms of situational awareness. We knew immediately in terms of the prison outbreak from a hospital perspective. And early on, we stated months ago that, for each one of us, because this has a cascading impact, so each one of us really does need to be aware. The school district needs to be keenly aware in terms of what populations within the prison could this potentially reach into the community. The prison was focused very quickly on isolation, identification, isolation, swabbing. Where the hospital backs up the prison is really on the swabbing side. They are they're fully capable of any medical issue that they have within their four walls or within their footprint. But we're there for backup. And whether that's informational advice or even transporting of swabs after their courier goes, they have us. So we built in, I suppose, a very formal redundancy. And I would say that was through Ken Gordon. When he brought us all together, we fully utilized that opportunity to share information. We know that for the prison, it does seem right now that there was the initial wave. There were 2 more reported, but it seems right now as we go through this week that it looks like it could be contained. That's great. That has impact on everyone across our community and probably the state. At the same time, there's also the ability to reach out into the Granite State Healthcare Coalition Web EOC. So if there's anything that we need that we do not have as a community, we definitely have access through the state. And so it's becoming well oiled. We realize that as the community reopens, you can just follow this wave of anxiety that follows by reopening, that follows by success, that follows by once in a while you'll get a COVID case. So it really is I think a well communicated process right now.
And has the source of the outbreak been determined?
It did start in, so there is a camp. I mean, we know this just from our Tuesday call. So this is shared with the community. But with a federal prison, there is a segment that is, I believe it's the location where inmates are getting ready to reenter.
The work camp.
Yeah, the work camp. So it began there. It was isolated. They very quickly brought that group into their quarantine zone, and they kept it within the prisoners. So I think there were a total of 6 prisoners. And then it did begin to show up, I believe, in 2 guards of recent. So you'll hear the number 8 at the same time 9. There had been an individual in the community that had tested positive unrelated to the prison, and that was the 9th. I think there's 2 more recent cases. And then if you look at our count this morning, we show an active count of 13 in the community. But it was identified very quickly. It was communicated out through our group. We're able to, thank the prison for their rapid action, but also ask if they need any additional help, and whatever resource they need, we try to meet that as a community. So they identified it quickly, they reacted quickly, they swabbed immediately, and again, just really trying to jump on this as fast as possible. And that's happened in the nursing home, it's happened in the hospital, it's happened wherever COVID is shown.
That's great. No, it's been encouraging to see how low the numbers have been in Coos County.
And that's while we're recognizing aspects of the community, for the nursing homes, unbelievable job in the North Country nursing homes, just phenomenal. I had the privilege of going over and seeing how they built their defenses in terms of COVID planning, and excellent processes. And I believe the states recognize them as well. But to have such a low incidence, no residents. And I will also put this out there that through this period of time, just respiratory infections dropped dramatically in the nursing home, not COVID related, just respiratory infections. They have done such a phenomenal job that they've actually lowered, this was a few months ago, but where they had no respiratory infections, where they would have had, maybe 10 to 20. So they're doing a heck of a good job.
And what do you attribute that to? Is it the mask wearing? Is it?
Yes, I was actually just going to say my next ask of you as one of our federal delegates is to continue to endorse and support those behaviors. I mean, social distancing, hand hygiene, and mask wearing, we've proven internally here it can prevent transmission, and that's what they attributed it to as well. In a normal course of a spring, they'd have all kinds of upper respiratory issues, and to have 0 in a nursing home situation, they say is extraordinary, and it's because of those behaviors. So hopefully, with any luck, we'll have a different administration and maybe a different tack here shortly. Would strongly encourage the consideration of a federal mandate for mask wearing, because it's proven to make the difference. And that's it's tragic to think how many lives could have been saved. But we've been able to prove it firsthand here at ABH, where we did have a positive case that was a worker, worked an entire shift, but because there was good social hygiene and mask wearing, 0 transmission.
Wow, that's great.
Awesome.
That's impressive.
So that's what they attribute that success to at the nursing homes.
Yeah, no, it's really unfortunate that it's gotten so politicized.
Correct.
Because, as you say, the evidence seems very clear about the success. I have my daughter was reading, my mother wrote her autobiography, and my daughter was reading it to my grandchildren, and she found a section where she was talking about her parents during the Spanish flu epidemic were crossing the country on a train, and she referenced the mask wearing because that was being required and recommended by everybody at the time to address the Spanish flu. So it's interesting that we have to reinvent what we know has worked for people.
Mm-hmm. So I'd also like to thank Chuck for being present at those Tuesday meetings, honestly, and thank you, Senator, for the letter we just received a copy of yesterday for addressed to TRICARE, and to make sure that the payers are actually covering the cost of asymptomatic testing. So we're grateful for that as well, because otherwise that falls on us or the patients, and that's not fair. So thank you.
Yeah, and if we say we're going to cover the cost of testing, then we need to cover it for everybody. Can I ask, what else are you seeing as you're looking at the next few months? Obviously, addressing the pandemic is one of the things. I was just on a call earlier with folks in Sullivan County, and we were talking about substance use disorders and what they're seeing. They're setting up a new family treatment court to help families who are dealing with substance use disorders. But we were talking about the increasing numbers that we're seeing now because of the pandemic and the difficulty with getting people into treatment in person and some of the other challenges of isolation. Are there any trends that you're seeing that you're concerned about, either with that or anything else?
Brian, you want to talk about the behavioral?
Sure. Yeah, we are concerned, and just very quickly on our weekly call with Ken, because he's over CCFHS and they have a behavioral health component, he closes every call really asking how we're all doing, and that he draws attention to the fact that this is a growing problem. We do see it in our behavioral health population. We do see it in our work population. So it is very real. And I will draw attention to the Partnership for Patients and the Hospital Association and the partnership at the state level. Clearly, one of the first areas that they are addressing coming back as we all reopen is really either it's substance use disorder dependence, and also opioid use. So we have ABH, we have entered into the relationship to really focus on OUD, but when you peel it back, it is SUD as well. So I think at the state level, there's a realization that we need to fund this. We need to invest here, and we're beginning at the emergency department. In our particular case, is focusing really in on providing additional education right now, following some protocols that help identify when someone presents with these issues, and then also educating the staff in terms of sometimes stigma, how to follow the protocols, but also how to get that individual the help that they need. So behind the scenes, it's a growing focus. I love the fact that we're addressing it clinically, really through trying to, I think, coordinate access across the state. We know the doorway is extremely busy. We know that in behavioral health, we had, when Mike referenced stay safe, stay home, well, behavioral health population did as well. And we knew that was a ticking time bomb. And in all reality, that has begun to come back. And you could argue some people have waited too long. I will say the mental health centers have done a phenomenal job just with telehealth and reaching out to the populations in new ways. But we do realize that is, if you were to look, what's the problem that's looming out in front of us beyond COVID? It's that. You're absolutely right.
You know, I think one of the few good news stories from this pandemic is telehealth.
Yes.
And the recognition of how effective telehealth can be, and finally making some changes in reimbursement so people can actually get treatment through telehealth. I'm really hopeful that that's going to continue. I'm going to be pushing for that. And I know that there's bipartisan support to continue the changes to allow people to continue to have telehealth treatment. So I think that's been very positive, and hopefully we can see it continue, especially in rural areas. And I know you all must see this a lot with people who can't get to the doctor's office or can't get to someplace for treatment.
Absolutely. Yeah, we had to pivot pretty quickly back in March, and people stepped up and the community has adopted it fairly effectively. Our providers have given testimonials, and some cases that the telehealth follow-up consults are actually better in quality than in person, because you have the rest of the caregiver team available to answer questions. So it's been a big win, and thank you for the support for the reimbursement adaptation as well. It's been
really great.
Yeah. So to build off of what Brian just mentioned, I want to also be respectful of your time, Senator. The workforce impact. You know, we quite serendipitously had just launched a wellness well-being index project among our caregivers, not just the providers, but the nursing staff as well, and have taken some baseline metrics and provided some resources based on the Mayo Clinic model. And we're in the midst of that now. There's some pretty distressing numbers coming out in terms of our baseline. Literally 50% of the respondents from our initial surveys in the advanced practitioner, not the MDs, but and APRNs, PAs, and so forth, come back and qualify themselves. This is a self-taken survey, as distressed. And that's really significant for us. We need to watch the burnout, watch and make sure that the providers of care are able. And so we're spending a lot of time consciously making sure that they're able to manage their way through this, because we depend on them as community members.
Absolutely.
So we're looking externally and internally at the impact of this. I think it's far too early to predict what the long-term impact is going to truly be, but we're going into this with our eyes wide open.
Good. No, you're right. Have you, I know that I'm supposed to get off here pretty quickly, but are you also working with the school districts? Because I know it's one of the concerns that I've heard from school officials, teachers, about not just the worry about kids who we haven't had eyes on, who may be victims of abuse or neglect, but just the general student population and their mental health as well as they
school, just and how do we recognize and what do we do for access to testing and so forth. So those communication channels were really opened up. There are some silver linings from all of this, and I think this is we should be a case study for example, in terms of the community coming together to share those kinds of it's just shared resources, really. That's what it is. Brian, I don't know if you want to add anything there.
Well, only that was the first time, I think, in the history of our community where nursing across whether the city or our part of the North Country came together, and we realized, based on our lessons with reopening, here the schools, you could sense that anxiety, and we thought, the school nurses, we need a relationship with the school nurses. And that was a wonderful session. It occurred through Ken's call, and it was all nursing. And I thought, what a historic moment. So, with all of COVID, there's been some silver linings here. And we built relationships that I think will weather any storm, whether it's how to get a COVID test or whether, oh my gosh, we're seeing a rise in abuse. It's that backbone and structure that we have just gone to, you can say gone to that well so many times, but it's always produced.
Yeah, no, you're right. I think it is a real model. And I think the North Country often is better at that kind of collaboration than some other parts of the state. Although that's a story that I've heard in many communities, which is very encouraging as we think about how to address issues in the future. James, since I have to get off, I haven't heard from you. Is there anything you wanted to add to the discussion?
Very briefly, my role has largely been in terms of internal and external communications. And with the rapid changes that we've seen since March, it has been a challenge to communicate this to our stakeholders. But our elected officials and their representatives have been fantastic to work with. So I thank you and Chuck and everyone who's played a pivotal role in helping me communicate that to our employees and stakeholders. So thank you.
Well, thank you. And as you point out, the communication is so important. I think the more the public knows about what's going on, they may be concerned, but they will at least have a good idea of where to go to get information, of how to respond, and that's really important. One of the things somebody said to me early on, who was talking about our public health system, he said, one of the most important things in an emergency for public health is to have consistent messaging so that people understand what's going on. And I think, as you all point out, that's continues to be very important. And it's nice to hear that you all have done a good job in getting out and letting people know what's happening. So thank you all very much. And I hope you'll stay in touch with us. I know you talk to Chuck regularly, and feel free to call Peter and let us know as we're starting the appropriations process. I hope, again, post-election, and as we're I'm still hopeful that we're going to get another package to respond to the coronavirus. The more we know about what your needs are, the better we can advocate. So please don't ever feel like you don't want to bother us. Let us know what's happening.
Thank you very much, Senator, for
Thanks.
your time. Thank you, Peter and Chuck and everyone else. Sincerely appreciate the FaceTime.
Thank you all.
Take
Stay
care.
safe.
You as well.